The state of Rhode Island has once again set a new daily record for positive COVID cases. Good evening, I'm Mike Montecalvo.
And I'm Shannon Heggie. 1,280 new cases were reported today by the Department of Health. The positivity rate is now at 7%. 6 more people have sadly died after contracting COVID, bringing Rhode Island's death toll to 1,284.
Hospitalizations have climbed to 284, which includes 22 people in intensive care.
In the meantime, many of you have been telling us you're struggling to get a test.
Brandon Truitt is covering that part of the story for us. He's live at the Rhode Island Convention Center testing site in Providence. Brandon?
Well, Mike and Shannon, there are 2 things we keep hearing from people. One, they're struggling to secure a test, and when they do, it's taking longer than expected to get the results.
Unfortunately, it's hard to get one right at day of.
They fill in quick.
Insight from just 2 of the thousands who got a test at the Rhode Island Convention Center Wednesday, both of them securing the test 6 days ago.
So if you are exposed, I think that's a little bit of a problem.
The Rhode Island National Guard has been assisting in facilitating tests for months. They tell me the state increased daily capacity here just last week.
We went from testing about 800 to 700 to 1,100.
But is it enough? 12 response has been flooded with testing concerns in the past couple of days. Many of you expressing a view similar to Ed's, who writes, "The governor always says it's easy to get tested, but when you try to make an appointment, it takes days. It's not as easy as she makes it sound." We took those concerns straight to the Department of Health.
We're trying to respond to the increased demand. I think what we would just ask is we really need to help decreasing demand, my friends. In other words, there's way too much disease out there.
The state says testing is at an all-time high, and so is the number of people looking for one. Increased transmission is causing ripple effects of delays, from booking to results to contact tracing efforts. But the Rhode Island National Guard says people showing up without an appointment is throwing a wrench in the system.
It backs up the line. It's just like at a doctor's office. You wouldn't appreciate if people showed up without an appointment, were being seen before you, and then you had to wait. Same way, we're urging everybody to be patient.
And you're seeing what's left of the line here now as the last appointments are wrapping up in the next hour or so. Now, the Department of Health says if you're struggling to get a test, try local doctor's offices or their other state sites that they have besides this one here in Providence. But they say the best thing that anyone could do is ultimately do their part in helping stop the spread. Live in Providence, Brandon Truitt, 12 News.
First tonight, complaints about getting COVID-19 tests in Rhode Island. I'm Shannon Heggie.
I'm Mike Montecalvo. The Rhode Island National Guard says they're doing more testing than they've ever done before. But we've been hearing from 12 News viewers the last few days about long lines, delayed results, and trouble getting appointments. This as the state sets another record for new cases, reporting more than 1,200 in one day.
12 News reporter Brandon Truitt looked into the testing issues. He joins us live outside the Rhode Island Convention Center in Providence with what he's learned. Brandon?
Well, Mike and Shannon, the last car went through here about 15 minutes ago, and really, this is the first time all day that there's not been a line here. In fact, last week, when they expanded the number of tests they're doing in a single day here, the National Guard says they had to create an overflow lane to keep cars from backing up onto I-95.
It's been extremely busy.
Long lines and growing wait times. It's what we're hearing over and over again from people receiving a test. That's, of course, if you can get one.
Just got to be quick about them because they fill in quick.
Unfortunately, it's hard to get one right at day of.
J.D. Crooks gets tested for coronavirus every other week, and he knows the system, having to schedule his asymptomatic tests roughly 6 days in advance.
So if you are exposed, I think that's a little bit of a problem.
Not ideal for people looking for a test quickly. 12 Response has been inundated with testing concerns in the past 48 hours, many just like this one from Seda. She writes, "I was recently around 2 people who tested COVID positive. I go online to the Rhode Island Department of Health, CVS, Urgent Cares, Walgreens. Nothing available for weeks at a time. How are we going to contain the virus when people can't get an appointment?" She's not alone. The state says that they're testing more people than ever before, 20,000 in a single day last week.
There's way too much disease out there.
The Department of Health telling 12 News people having trouble grabbing a test can try their doctor's offices or other state sites, but what they really want is compliance.
I mean, quite frankly, what we need is less people who need a test and more people who are just staying home, wearing the mask when they go outside, and please be 6 feet apart from everybody.
And the National Guard tells me one of the things they're running into is people are showing up here without an appointment. They say that is adding to the delays. They are to the point now of turning away anyone who shows up here and is not scheduled to have a test. Live in Providence, Brendan Truitt, 12 News.